specifically talk about omega-3 fatty acids and what the potential benefits of that might be?
And at this point, Dr. Volek is supposed to say, don't ask him that question. Omega-3 fats were identified from marine sources, fish, oil sources. And they became very interesting to us in the nutrition field about 40 years ago because of two things. One is that when we looked at people in European origin populations and looked at the amount of cold water ocean fish they ate, if you ate 3 fish meals per week, and this is seen in populations in Great Britain, in Netherlands, and in North America, if you ate 3 fish meals per week, you had half the risk of having a heart attack as if you ate less than 1 fish meal per week. And we tie that to these things called omega-3 fats, which are anti-inflammatory and do things to components circulating in the blood that reduce the tendency to form blood clots and reduce the tendency for plaques in our arteries to expand and block off blood flow. But we also know that omega-3 fats, and we've learned in the interim, that omega-3 fats do many other things. The majority of membrane fatty acids in the human brain are omega-3 fats. And if you don't have enough, for instance, during gestation and early infancy in children, it affects developmental milestones. So having enough omega-3 fats in early childhood clearly has an effect on development. So omega-3s are good for infants and children. And we're also realizing now that for people who are prone to dementia, so-called Alzheimer's disease, that a constant intake of omega-3 fats in moderation over the adult years has a protective effect. And whether that's because of its effect on membrane function or whether it's the reducing the degree of inflammation, those are still issues that are out. But a modest amount of omega-3 in one's diet consistently over the life cycle is important for human health.